This is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 19 minutes after 11 o'clock. Thank you for tuning in. You know, we have some pretty severe weather out there.
Yeah, we do.
Fortunately, right where we're broadcasting from, we're fine. But in our broadcast area, there are some people right now dealing with Hurricane Michael.
Yes.
And so we've been doing our best to keep up with the weather. And we're not weather professionals, but we know where they are. They are on TV. And so we go to we go to the TV channels, and the quality of the picture is so pristine. I mean, I can look right into their teeth, Robin. I can see their smile.
I know, isn't it great?
Right? Who's the lady from Channel 2 that we had on yesterday? Talk about what was her name again?
Oh, Amy Sweezy.
Amy Sweezy. Have you seen her beautiful smile?
I have. I'm jealous.
Oh my
She's
gosh.
Absolutely outstanding.
Oh my
Gorgeous
god. Oh my
woman.
god. And I mean, it's perfect. So I don't know what people do, Robin. I gotta talk to somebody.
Well, your teeth look pretty good to me.
Well, that's what you think.
Well, okay.
When I was a kid, the dentist gave me some fillings, and he said, this should last you 40 years. You know, he was right.
Oh, okay.
40 years later, there's some missing pieces in there. Dr. Nami Patel is on the phone. She operates a dental practice called Green Dentistry in San Francisco, and she's got a book called Age with Style. She also has a beautiful smile, by the way. I'm looking at the cover of her book right now.
She's gorgeous.
Good morning. It's an honor to have you on the show, Doctor.
Hi, how are you?
I'm good.
Thanks for having me.
You have such a nice smile. Does everybody tell you that?
They do. It's really nice to be able to the gift of smile is so important, to be able to show our gratitude, to show our happiness, show our love, kiss them, right? We're all about kissing here.
It is.
Yes, about kissing.
It's about kissing. Oh, I didn't know that part.
That's good. Gotta have good teeth to be a good kisser.
Wait a minute. Have you seen these tooth pill tablets instead of toothpaste? Have you seen these things?
I have seen the tooth tablets, but toothpaste doesn't really matter if it's a tooth tablet or a toothpaste. What really matters is the mechanical action of brushing. So an electric toothbrush is really what you really need in order to get all that bacteria off. Really?
So I need to get that, because every single time I've had a dentist ask me to brush so he could see how I was doing, they tell me I'm doing it wrong. And it's like one of these skills. I just don't have a coach. I need a coach.
You say you're the green dentist. How does that differ from the other dentists that don't label themselves as that?
Yeah.
Well, there's several ways that we're green. The first and most important is the way we work with our patients, and hence the book. We really look at long-term care. We really look at how can you keep your teeth when you're 90? How can you chew properly when you're 90? How can you be comfortable? How can you save time, effort, energy, money, and teeth? So that's a first one. And also, it's the way we work with our patients as a partnership. So that way, there is zero guilt and shame. It's absolutely about education and empowerment, so that you can better take care of your teeth. And make sure that you're living a healthier, joyful life. Also, the materials that we use are eco-friendly, so no bisphenol, which is a cancer-causing agent. Also, our crowns are made in the office with a 3D printer, so we're saving on the carbon footprint of shipping, a mold out to somewhere in Timbuktu and having it come back a couple weeks later. It's much better for your body because you're not having to get numbed up several times. A lot of times I can do the work with lasers, so that way you don't even need a shot.
How about hormone imbalances? I mean, for women, because we go through this change of life, sometimes we want to take estrogen, sometimes we don't. How does that affect the teeth?
Huge. So there's something called estrogen dominance. I'm so glad you asked. So hormones impact the teeth tremendously, and sometimes people don't really look at the mouth as a whole body, and that's really important to change and pay attention, because the hormones are signals. They're like traffic lights. They tell the body when to do things, when to start, growing your hair, or when to start getting your period, or, let's see, grow your nails, for be another example. So hormones are really, really important in regulating regulating daily functions of life. When there is a hormonal imbalance, it leads to cavities, it leads to gum disease, and its effects could lead to diabetes, decreased immunity, heart problems, and really people really discount the mouth, which is not healthy. It's important to look at the mouth. A healthy mouth is a healthy body. And also when looking at hormones, when there are healthy hormones, you will see a sign of health in the mouth. The gums will be pretty and pink. There will be zero bleeding. There will be fresh breath, and they are all indicators of.
So do you, as a dentist, are you able to diagnose a hormone problem or an issue?
I do, mainly because I have a functional medicine background. I have taken additional training to be able to do that. So when women have any sort of hormonal issues, we're actually able to tell because there's a specific type of tissue that we can actually look at, and that actually tells us how the gums actually look, and it tells us what the problems are. So that's a key thing to look at.
How about men with testosterone? Do their levels decrease with age?
They do, and we also see men with, mainly it's around the 50s age is when we really see a lot of gum inflammation in men, because as their testosterone goes down, their estrogen does go up. So we definitely see boggy tissue, we see bleeding, we see bone loss, receding gums, Menopause is what I call it.
Oh my
there you
gosh!
go.
All that stuff happened. Oh my god! So, can I ask you about mouthwash? Is there a tell me about mouthwash. What are your thoughts on that?
Honestly, mouthwash, again, it's kind of like toothpaste. You don't really need it. If you're effective with your flossing and brushing, you're going to be able to get all the bacteria out. Mouthwash is purely marketing. It's there to make you feel better. It's a sign of freshness. But functionally, there is no need for mouthwash. If you were going to use something, you can use something as simple as saltwater rinses, or you can use peppermint oil in some water, and that would make you feel fresh as well. So that way you can avoid all the chemicals that come in regular mouthwash.
Really? What about some people use hydrogen peroxide as a mouthwash? Is that a dangerous thing to do?
It's, hydrogen peroxide, if it's diluted, then it's okay. But full-on hydrogen peroxide is going to be really potent for the tissues. Peroxide in general kills off bacteria, which is great, but it's got to be diluted to about 0.5%, which means a tablespoon of peroxide in an 8-ounce glass of water is what you want to use.
So can you talk to the people who have had problems and it's too late for them? They've lost their teeth, or they've lost some of their teeth. Does some of the things we've seen, what do they call implants? Are they a good idea, or is it better to do the old-fashioned denture thing?
I was going to say it's never too late for teeth. Thank God for implants. That is revolutionized the dental industry. Implants are basically like planting a root of a tooth, and so implants are amazing. They actually give you form and function, and you're able to chew properly with it. You're able to taste your food. You're able to be comfortable. You can go out and smile and not worry about dentures popping off. I highly recommend implants and implant retained dentures. If you've lost all your teeth, there's something called implant retained dentures that you can wear, and they're very comfortable. They're long lasting. They look good. They feel good. I would highly recommend them.
And now, how do you help the person that doesn't have a lot of money? Because dentists, at least in our area, they're expensive when you want to have good oral health.
Dentistry does cost money, just like anything else. As far as a good dentist will offer financing plans. So there's a lot of companies, like for example, in our practice, we work with Care Credit. So it offers 0% interest-free financing, so that you can pay for, implant retained denture if you needed one, and you have up to 24 months to pay it off interest-free. Your payments can be as low as $250, $300, or whatever is comfortable for you. There's also other plans that can extend up to 5 years and 7 years, and you can look at payments of $100 a month, which is pretty comfortable.
The book is on Amazon. It's called Age with Style. It's written by Dr. Namrata Patel, and I was going to ask you, Doctor, if you have another website you'd like to direct us to.
Absolutely. My office website is www.sf, so as in San Francisco, greendentist.com.
Oh, that's easy enough. sfgreendentist.com. Dr. Patel, thank you for that. It's very encouraging to know that that all is not lost. Those of us who have had some tooth issues, I'm one of them, can get it all back to normal. Thank you, doctor.
Okay, thank you. Bye-bye.
We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville.